My name is Sanjay Sachdeva, and I work as Senior Vice President in the Healthcare and Life Sciences vertical at One Lattice. One Lattice is a next generation tech enabled market research and insights, business consulting, and advisory organization. Today, the topic of our discussion is ostomy care market, recent trends in India and at global levels. And to discuss the same, we have with us Mr. Pranav Chopra, who is the co-founder and managing director of Crimson Healthcare. Pranav has educated at IIT Madras and Cambridge University, and he comes with an elaborate 15 years of experience at national and international level. He is also a fellow in the Stanford Biodesign program. And Pranav has been running Crimson Healthcare since last few years, which is an organization which focuses on uh, producing and distributing revolutionary products to manage the ostomy care situations and patients. So, Pranav, it's very great to have you here today, and we would like to, understand more from you on this interesting topic. So, how come the idea of launching an ostomy care based products organization came to your mind? Just to start with.
Thank you, Sanjay, and thank you, One Lattice, for having me on this podcast. And thank you for your lovely introduction. I've been in medical device development for a long time. It's been more than 15 years. I've worked in the UK, in the US, at the global level. My expertise lies in building R&D enabled organizations. That's my experience. And when we did the Stanford Biodesign Fellowship, one of the needs that we were looking at was ostomy care, and we found a major gap, which is basically patients still have to wear a bag hanging from their waist in which they collect their stool, right? And now these are patients who have defeated cancer, many of them, right? And even after achieving such a great victory, they still have to live a diminished life, a smaller life with a bag full of their own feces hanging from their waist and going about their daily business. They should be able to work. They should be able to live like everyone else. And we found that that's something that has not been addressed so far by anybody in this sector. Right? Ostomy care is a niche sector, and we would have hoped that some solutions would have been made available for patients to live a better life. And we realized that's something where we can add value, our team can add value. And so we thought we will attempt to provide continence to patients, have them be able to go to the toilet in a more normal fashion. And with that aim in mind, we decided to found Crimson Healthcare. We have a few patents that we filed. We developed our products, and we said, well, taking it through the startup route is the best option for us as well as for patients to be able to access our products.
That's interesting because you touched upon, one kind of challenge that such patients are facing, which is, the traditional continent collecting devices like pouches and bags you talked about. So, in your experience, what all other challenges these patients are facing apart from the challenge which you just mentioned?
Yes. So, see, when we went out, did our research, and we met with a lot of patients in Ostomy Society, both in Delhi and in Bombay and Pune area, we met with more than 50 to 60 ostomates, asked them about their experience and what are their main pain points. What we understood were they have three to four key issues with their condition. First is, of course, they have to they are defecating in a bag. They have to hang a bag, which needs changing every 3 to 4 days. It needs emptying multiple times a day. It's a messy affair. It takes a lot of their time and effort to just manage their feces, which you and I, take 15 minutes a day, right? These guys have to, constantly think about it. And whenever they have to do their ablutions, it takes more than an hour, hour and a half to do that. So that's one big challenge, which is basically a disruption in their life. Apart from that, things like odor. There's a lot of smell that comes through bags. If there is gas, then there is ballooning of the bags. If the gas release mechanisms in most of the bags are not appropriate, or cannot handle enough, can only handle small amount of gas release, not large amount of gas release. So that's another problem that patients face. um, Social stigma is a big thing. People don't talk about this issue. Again, it all stems from the fact that they still are carrying their feces outside their body. It can They want to hide it under their clothes, but then with bags, if they balloon with gas and all, it shows. With the smell, it you can you personally, the patient feels uncomfortable. So social aspect is a big thing for patients. Travel becomes hindered. They can't travel without constantly worrying about where, if they need to change a bag, where will they be able to change a bag. Train toilets and bus travel becomes very difficult. So all of that, the disrupted life, um, managing the bags is a painful and a time consuming affair. Smell, social stigma. Apart from that, leakage is a major issue that more than 80% of patients face. And due to leakage, the skin around the stoma gets damaged, and that's the clinical problem that a lot of patients face, and that's the primary clinical reason why patients have to go back to the hospital or to nursing care to get that skin issues resolved. So skin damage can be a very serious affair with such patients as well.
Understand. So I think there are a lot many issues. The patients post an ostomy surgery they are experiencing and adjusting to a new lifestyle, and then as you talked about, a lot of psychological and physiological issues are there. So just to understand more in terms of your innovative solutions from Crimson Healthcare, how you have been able to address these challenging issues with your solutions.
Yes. So, like I said earlier, we went into this business primarily focusing on providing continence to patients, helping them be able to go to the toilet in a more normal fashion. So, our products, we have two innovative products which are patented. And the first one has been approved by CDSU in India and is available for use and sale in the market. So these are continent devices. Our first device, which is available in the market, is for colostomy patients and colostomy patients. This is an external device which can be used instead of a two-piece bag. So the base plate remains the same. Instead of the bag, our device can be attached, and the patient can actually open and close that device very simply to be able to go to the toilet. So our Crimson Stoma Cap is an innovative solution for colostomy patients. They don't need to carry a bag constantly hanging from their waist. They can use our Stoma Cap, which is a continent cap, and allows the patient to go to the toilet and evacuate in a very simple manner, and can be cleaned very nicely. It also gives them flexibility to use a bag as well as our product, as well as the stoma cap, um, as per their requirements. Some patients feel more comfortable using Crimson Stoma Cap at night. Some patients feel more comfortable using the Crimson Stoma Cap during daytime when they have to go to the office or when they are outside in social environment. So that's our first product that has been launched. The second product is under clinical trials at AIMS New Delhi. That's the Leona Port, which is for ileostomy patients, where the stool is more liquid and is more corrosive. So it's a much more advanced solution, which again works in a very similar, on the same principle as the Crimson Stoma Cap, but it does not require any adhesive either. So it completely isolates the inside to the outside and allows the patient to defecate just by going to the toilet like a normal person.
So it's looks like an quite an innovative products which addresses a lot of challenges as you shared. So as you have a lot of international experience also and now experience in the Indian market also. So how do you compare the market dynamics of ostomy care segment in India and as well as at a global levels? So what are your views on that?
It's very interesting that you've asked this question. The Indian market and the global market is very different. Um, as you know, across the board, Indian market is very price sensitive. That's one major aspect of the Indian market. People are more concerned about how much it is going to cost. Our devices are very cost effective. The patient has to pay about the same amount of money that they spend on bags in a month. They can, instead of spending it on the bags, they can buy our products and use them. So we've kept the price. Our products are fairly price competitive. But if you want to compare the Indian and the global scenarios, in Europe and US, the ostomy devices are paid for by insurance companies, right? So they're covered by insurance. Whereas in India, the devices are paid out of pocket, which makes this sector for the patients much more economically burdensome. So there's a bigger economic burden on patients because of that, and hence the price sensitivity becomes even more important, right? That's one key difference. Um, because of this fundamental key difference, innovation and manufacturing also varies in both these geographies. So in India, we have only one Indian manufacturer who caters to the mid to lower level of economic strata. The rest of the market, 80% of the market, is catered to by the three major players, the global MNC players, which leaves a big room for ostomy care companies like ours to bring in products and help our customers. In the West, again, these three major MNCs hold the greatest market share. However, there are a lot of innovative companies that provide new products in both US and Europe. So you have a lot of lifestyle companies coming out of the UK where they have ostomy care, clothing lines to, improve self-image, cover the bags, make the bags look nicer for younger patients. Those are some of the UK-based companies, whereas in the US, there are more functional products available for patients. There is a company called Stoma Genie, which has a product which helps patients, manage the leakage while changing bags. Then there is another company which makes odor eliminating drops. Um, so there are innovative companies in the West, and they are able to provide that to the patients primarily because the products are catered to by insurance companies. They're covered by insurance, and that allows the patients to try better products for themselves without having the burden of paying for it themselves. And I think that is the key difference between the global and the Indian market. Well, from an economic standpoint, the global markets are also saturated, right? So they are growing at around 4%, 4.5% annually, whereas the Indian market is a with more and more, as India becomes a middle income country, the purchasing power is increasing. People are willing to spend more on healthcare, and with that, the and access to healthcare is also improving. So with these factors, the Indian market is growing at a 16%. Indian ostomy care market is growing at 16% annually. So there is a uh, Indian ostomy care market is a smaller market but growing very fast, whereas the Western markets, Europe and US markets, are fairly mature markets. They are innovative, but their growth rates are plateaued. They grow about at 4%, which is more of an organic growth rate based on the underlying disease growth. So that's in my opinion the key difference, I think, between Indian and the global markets.
Yeah, that's interesting. You talked about the 16% growth market in the India. So, as per your understanding, what is the volume of such surgeries, happening in India at an annually? How many such patients would be there suffering from the ostomy conditions, and what are the leading indications for the same?
So I'll start with the indications. The primary diseases which lead to an ostomy surgery are colorectal cancers and ulcerative colitis. These are the two major reasons. Apart from that, the smaller contributions are trauma or perforation of the intestine or diverticulitis. These diseases cause maybe 2 to 4% of the ostomy surgeries, but the major chunk happens due to colorectal cancers and ulcerative colitis. Um, uh, as far as the number of patients, when I mentioned 16% growth rate, that was in economic terms. But in patient volume, it's around 9 to 10% growth rate annually. So as more and more people are able to access healthcare and better diagnostics is available to patients, they get their treatment done better. So there are about 10%, 9 to 10% growth rate in the patient volume. And at any given annually, around 100,000 such surgeries are done, which encompass colostomy as well as ileostomy surgeries in India. And I think when we did our primary research, we went to a lot of different hospitals, understanding how many such surgeries they do every year. We estimated it to be around 120,000 surgeries every year. And at any given time, we estimate, by our primary research, we estimate around 3.5 to 4 lakh patients living with ostomy at any given time.
Okay. So that's a significant number of patients in terms of total patient pools as well as new patients being added every year. So, what kind of government policies or support has been there, or you are seeking, to make this segment more uh, impactful for the patients, particularly?
See, I think one thing the government has recently done, which is a great thing for ostomy patients, is they've reduced the GST on ostomy devices. Right? So the GST rate was previously 12%, which is a generic rate for medical devices. But for ostomy supplies, the GST rate has been brought down to 5%, which is a great thing for patients because they are end users and their burden, economic burden reduces a little. So that's the kind of policies we would like to see for patients, but to that has to be followed up for manufacturers as well, because in India the medical device manufacturing is still very early stages. We still import 80% of our medical devices from abroad, um, as well as the fact that even raw materials that are required for manufacturing such products have to be imported, right? One classic example is the hydrocolloid adhesive that is used for ostomy supplies. No, there is no Indian manufacturer for medical grade hydrocolloid adhesives in India. So that has to be imported. But the import duty on that should also be reduced commensurately. Because if it is still being charged at 12 or 18%, then that cost also has to be passed on to the customer. So if that is reduced commensurately, maybe to 5%, that will also reduce the economic burden on the end patient. The other thing which I believe would help patients a lot is to start including ostomy devices. Uh, Ostomy devices should have insurance coverage. Once the insurance companies start paying for it, then patients will be able to utilize the different types of solutions that are available in the market much better. And actually, the overall healthcare burden will also reduce. The economic burden of healthcare will also reduce in such case because a lot of times patients, due to economic considerations, tend to overuse the devices. Right? So where a bag should be used for 3 to 5 days, patients tend to use it for 10, 15 days and reuse the bag again and again, which leads to leakage events and which subsequently leads to really bad skin problems. And then the patient lands up in the hospital again. So which in turn, in the grander scheme of things, increases the economic burden of healthcare. Right. So if ostomy devices are covered by insurance companies, then that would really improve the health of patients and in the end reduce the healthcare burden. I'll give you a small example, right? So the number of surgeries, ostomy surgeries that are done in India are about the same as the number of surgeries annually done in the US, about 100,000 plus minus 10%. But the number of patients at any given time in India are about 3 to 4 lakhs, whereas in the US, they're about 10 to 15 lakhs. So the patient lifetime after surgery and the quality of life after surgery increase is much higher in the US than in India. Right? So if and in the US, Medicare as well as private insurance companies mandatorily pay for ostomy devices. So the patients are able to change more frequently their devices, their supplies, and therefore live a much more healthier, more productive life. They are able to work and get back into the and contribute back to the economy. They're also able to live longer. Whereas in India, a lot of these patients are not able to take care of their ostomy better. Their life quality of life is also reduced, as well as they are not able to work. A lot of people fall out of the working force. They become a burden on their families, and is a chain of events which just increases the economic burden of ostomy um, disease. So I think two things I would like to see. One, reduce the import duties on raw materials for ostomy devices, and two, insurance coverage for ostomy supplies. That would be a great policy change in our country.
Yeah, thanks. I think that's very interesting to note. As you touched upon the quality of life and comparison between India and US patients. So my last question to you would be, because I believe creating an awareness amongst the patients how to live a better quality of life is very critical in such segment. So what kind of patient support programs as an innovative organizations you are working at, or you are rolling it out soon?
Thank you. That's an amazing question because see, ostomy care is provided primarily by nurses. The key healthcare professionals who are engaged in providing healthcare to patients are nurses after the surgery, right? So nurse education is an important thing. It's a very important thing. Unfortunately, in India, we have less than 100 trained stoma nurses. In India, they are called ET nurses or enterostomal therapy nurses, and they are less than 100. There are only two centers in India which actually provide formal training for ostomy care to nurses. So, nursing education is a very important thing. We work closely with a lot of nurses. We ourselves train them. We uh, help them getting trained through the official centers. That's one thing that we are working on, and we have to increase that activity in our organization. The other thing that we realize that as an innovative organization, as a new startup, we need to really leverage technology. So we have developed a mobile application which helps patients take care of their own ostomy much better. It empowers them to monitor their ostomy output, help them remind when to change the devices. They are able to engage with our team, our customer care directly. They don't need to depend on suppliers. Currently, a lot of ostomy patients depend on the the person who sells them the devices. They are actually call them up and ask, hey, my bag is leaking, what I should do, because nursing care is also expensive. So they can with our app they can directly contact us. We can connect them with nurses, we can connect them with the appropriate person who can help them answer their questions that they have just after surgery. And even those who are experienced patients, sometimes they have questions, sometimes they just need some help. So our mobile application is a platform which helps them engage with our company directly, more continuously, and we provide answers and solutions on our mobile application directly to them. So that's something that we've been working on. um, our mobile application is also live. A lot of patients try to use it. But our products are our stomach app is also very intuitive and very easy to use. So the first time they use it, we provide a video consultation on our app, and guide them through the process of using our stomach app. And once they're used to it, we've not had a callback from patients saying, I don't know what to do. But so we are very happy, and we are very proud of our innovation, which is very usable, and patients are able to use it without any subsequent help.
Certainly, I think that's very useful to use the technology-based solutions for patient care and patient support programs. Uh, so, thank you very much, Pranav, for answering these queries that we had, and giving such wonderful insights, and also sharing your journey as an entrepreneur and coming into this niche yet exciting segment. So, I believe your insights will be very useful for many entrepreneurs across. Thank you very much again for your time today, and see you soon. Bye bye.
Thank you, Sanjay. Thank you, One Lattice, for giving me the opportunity. I hope our audience found this video very useful. And thank you. Thank you again.
Good day to you. Bye bye.
Good day.